of introducing Jim Tedford. He is the president and CEO of the Association of the Animal Welfare Advancement, a professional association of leaders in the field of animal welfare and animal care and control. To learn more about Jim's background, please check out his bio under the speakers tab. Today, he will be talking to us about lessons learned in animal welfare from the COVID-19 response, and not all bad. Please help me welcome Jim.
Well, thank you very much, Laura. I appreciate that. And it's great to see so many familiar faces. I just scrolled through the folks who are in the room with us, and I saw a lot of people I know and some blasts from my past. So awesome to see you all again. I wish it were in person. Although the last time I was scheduled to present at this conference in Nashville, I had a blowout on the way on I-40 between Knoxville and Nashville and got stranded on the side of the interstates. So maybe this is safer if we're all just sort of sitting here on our Brady Bunch Zoom screens. So thank you again for having me. This topic is sort of something that I think is near and dear to my heart and probably to all of yours as well. It's really pretty remarkable the way that we kind of reinvented the wheel in very, very short order when we were presented with this set of circumstances around the COVID-19 pandemic. It's been a long, hard ride for a lot of us, and I know a lot of you folks have put in incredible amounts of time trying to just sort of navigate these waters that are unknown to all of us. None of this has been navigated, so it's pretty crazy what we've managed to accomplish, I think, in a relatively short order, and without really, I think, a whole lot of struggle. I feel like we, and we'll talk about this in a few minutes, but I think in our field, one of our strengths is that we know all about how to manage a crisis. It's something we kind of do every day, because every day sort of presents its own new set of crises for those of us working in animal welfare and animal care and control. So we're good at it, and maybe that's why it felt like we navigated it really, I thought, pretty beautifully. So I want to talk just very briefly about my background. For those of you who I don't know, I've been in this field now for 37 years. I stumbled into my first animal shelter. It was then called the Knox County Humane Society here in the Knoxville area. And right out of college, I had just stepped out of UT with my bachelor's degree, and I decided I wasn't going to apply to vet school. So what am I going to do? And the local Humane Society had an opening, and I applied for it. And I think I was probably the only person they could find willing to work that cheap. So they hired me, and the rest is history. If you had told me I'd still be talking about this and doing it and working in it every day 37 years later, I would have told you were crazy. But I probably don't have to tell any of you that once you're in this, you're in it. It kind of gets into your blood, and it very quickly transforms from what you do to who you are. And I can't imagine really honestly doing anything else. When I retire in a few years, I'll probably still figure out some way to keep my finger in the pie, because I think it's just such important work. And in many ways, it's stressful and tough, but it's also incredibly satisfying. And so I can't imagine not doing it, quite honestly. I was the chair of the board of the Association for Animal Welfare Advancement back when we were called the Society of Animal Welfare Administrators. And that was over 20 years ago. I've been a member of this group for over 30 years. And so it feels sort of surreal that now I'm in the CEO position here and actually running my professional association. But it's as I said, really rewarding work. This is our mission. If you're not familiar with us, I would encourage you to please visit the website. It's theaawa.org. And just take a look around. I think you would find that there is a place for you. There's always been this notion that unless you're a senior level manager of an organization, that this isn't the right organization for you. My point is that if you are a leader, and I don't think you have to be a CEO or a VP or a director to be a leader. I think there are leaders in our kennels, there are leaders in every aspect of our work. And if you consider yourself to be one, or want to be one, or want to be a better one, then this is exactly the right place for you to be. You will have access to a network of your peers and colleagues, not only in your own state, but all across the country, and beyond. We've got members in Australia and Canada and the UK. So there are folks all over the world who are there to provide support and information to one another. And it's a fantastic network. I don't think I would have made it this long in the field without really having access to that network. So the new normal, it's one of those phrases that we are hearing constantly. You know, we all are having to adapt to the new normal, whatever the new normal happens to be. And, you know, along with things like social distancing, who had ever heard of that phrase before a year and a half ago? You know, all of these, the words that are unprecedented has become one of my least favorite words. Pivot. We had to pivot. Words that felt really innocuous a year and a half ago, didn't really think that much about them, and now it's almost like somebody scratching on a chalkboard sometimes when you hear them, because we've heard and used them so frequently. It's been a really challenging time for not only for folks in our field, but for folks everywhere. If you think about, you know, the whole great big world out there beyond our industry, everybody has had to struggle. It sort of has leveled the playing field in a lot of ways, because we've all had to sort of reinvent the way we do almost everything we do. And we can call it the new normal, but there's really nothing normal about that. It's something that you know, we have never had to do, and hopefully we'll never have to do on this scale again. When I start reading about the Delta variant and all the other things that are coming up and changing about the pandemic even today, I get a little bit of a chill down my spine, because it feels a little bit like deja vu all over again, like we're going back in time just a little bit. So, as I mentioned earlier, this crisis has really presented major challenges to our field, animal welfare and animal care and control. If you're involved in housing, sheltering, caring for, fostering animals in any way, this has been a tremendous challenge. But it's not our first crisis. It may be the biggest. I would argue that it is the biggest crisis we've all dealt with, but it is far from the first, and it's far from the last, I suspect. The beauty for us in our field is that challenge is kind of what we do best. And in the last 40 years, think about that. Think about this, because it's something that I think we don't stop and sort of celebrate the progress we've made nearly often enough. But if you take a second to think about it, when I got into the field 37 years ago, we were a very, very different world when it came to the well-being of animals in our communities. You know, our shelters were taking in, the best estimates back then were somewhere around 12 to 14 million dogs and cats entering the shelter system every year. And the vast majority of those animals did not have positive live outcomes. Most of them were ending up euthanized in those shelters, simply because of the volume. The volume was overwhelming. There were not enough homes to keep up with that supply. And so they ended up having less than desirable outcomes. In less than 40 years time, which, you know, to me it feels like a really long time in a lot of ways. I mean, I've lived through all of this change, but you know, in the scheme of things, if you look at the world, the history of the world, 40 years is a blip on the radar, and we've changed the world in that period of time. We are no longer dealing with the issues that we were dealing with then at anywhere near the same level. Now, you know, I want to make sure that I don't sort of sugarcoat this entire thing, because I do recognize that there are still parts of the country, there are still parts of our own state where we're dealing with mass overpopulation of dogs and cats, where shelters still can't keep up. The supply far exceeds the demand. But the good news is that if you look at it on a national scale, it's incredible. You know, we no longer, back 30, 40, years ago, we were dealing with pet overpopulation at our core. We no longer really have a pet overpopulation problem per se in the US. We've got a distribution problem. We certainly still have a lot of animals in places where their supply exceeds demand, but we also have some strategies for moving those animals to places where they're safe, where there's a higher demand than there is supply. I've got friends who run organizations in New England, for example, and if it weren't for transport of animals from the South to those regions, they wouldn't have any animals in their shelters to put up for adoption at all. So ultimately, we just need to figure out more and continue to fine tune the strategies that we have in our back pocket for improving the lot in life for animals nationwide and not just in certain regions. But when you consider that we've had close to a 60% reduction in the intakes at shelters over the last 40 years, that's remarkable. The first time I heard one of my colleagues, I think it was somebody in Colorado actually, who was expecting a transport and they were getting a load of cats from out of state to put up for adoption. And the notion that somebody was actually transporting in cats because they didn't have enough cats to keep up with demand in their community was, I actually kind of laughed out loud at first because I couldn't imagine that could be true. Certainly from my ancient history in the field, that felt like it was something that would never, ever, ever happen in my lifetime. And the fact that it did kind of just makes me almost giddy. It's just remarkable. So, if you think about the rate of sort of improvement in the numbers and the bottom line over the last 35, 40 years, imagine what we can do in the next 5, 10, 20. Now we have technology, we have the ability to connect with one another in ways that we did not have 40 years ago. So it's pretty remarkable the progress that we can make here. So I say that because I like to frame this conversation around the fact that those of us in animal welfare work are world changers. It's what we do. It's what we've done. We've proven that it can happen. So when it comes to the COVID response, we've just got to sort of stay the course and keep our eye on that prize as well. So if you're familiar with pet health, and there may be some folks from pet health actually on the call, a lot of you are probably using PetPoint or Chameleon software to manage your shelter populations. And pet health has, from the very early stages of the COVID pandemic, they've been reporting out on the crazy fluctuations in intakes and outcomes for shelter animals. And it's for a long time, they were doing a weekly call with a large group of leaders just to sort of report out what the data were actually telling us. Because, we all saw it in our own organizations, and we were hearing anecdotally from shelters all over the country what they were seeing. But Pet Health was able to really quantify that by looking at all of the organizations in their network and looking at mass amounts of intake and outcome data to tell us what was happening. So recently, Steve Zeidman, our buddy from Pet Health, who publishes a blog on a pretty regular basis, and I put the address for his blog on this slide. I'd write that down and subscribe if I were you, because there's always some really good information. Love data, and one of the things I joke about all the time is I remember back in the early days of my career in animal welfare, we never let data get in our way. We just forged ahead and we made decisions based on what we thought was right. We did a lot of stuff because we'd always done it that way, not because we really thought we had any evidence that it was working or it was the right way to do anything. And of course, back then, I remember being in an animal shelter when we got our very first computer. And it sat on a table for about 2 months after we got it without being turned on because we were all a little scared of it. So, we've come a heck of a long way. Now we're all carrying little computers in our pockets and can access data in real time. And it gives us fantastic information upon which to base logical, sound, solid decisions as we move forward. So Steve published a blog a week or so ago, and in that blog, he had some really interesting numbers for right now, what's happening so far in 2021 as the world has started to sort of reopen, shelters have started to reopen. And interestingly, his numbers show that shelter intakes are trending closer to the levels that they were at back in 2019, which was kind of our last normal year prior to COVID. But we still haven't quite gotten there yet. We still haven't quite reached those 2019 levels as far as intakes are concerned. Are we going to reach those levels? It's kind of anybody's guess. I mean, it's definitely something for us to keep our eyes on. I think a lot of folks were hopeful that because shelters emptied out during the pandemic, that they would stay that way, and that folks would find alternate solutions for addressing animals in need. And I think that happened during the crisis, but as folks are getting back to their kind of normal lives, where they're going back to work or they're going back on vacation and they're able to travel and see one another, this may not be as top of mind for the average citizen as it was a year and a half ago. Steve also determined from the data that length of stay is increasing. The cat numbers have actually exceeded 2019 levels as far as length of stay in the shelter, and the dog numbers are rapidly catching up. One really important statistic, and we're going to talk about foster care in a few minutes, but he also noted that foster starts, animals going into foster care, are down considerably over where they were a year ago in the early stages of the pandemic. And we all probably have experienced the notion that transports have slowed down in significant ways. And there are probably a lot of reasons for that. As I talk to shelter leaders all over the country, even in places where supply has really diminished over the last several years, they're still seeing shelters that are full. And when they're full of animals from their own communities, it makes it much more challenging for them to bring in animals from outside the community and work them into their system. Into their systems. So, transport. And the other issue is that a lot of these organizations had to downsize their staffs during the early stage of the pandemic. There were furloughs that happened and whatnot across the country. And now it's no secret that everybody's looking for staff, whether you're in animal welfare or not. Look at every business you visit. There are help wanted signs all over the place. Nobody has been able to ramp up their staffing levels to the extent that they would like to. And that may also be a factor. And then to maybe a lesser degree, hopefully a lesser degree, there are bad actors involved in transport. And if animals are being sent from the deep south or other places around the country up to the upper Midwest or the Northeast or out to the Northwest for placement, they need to be healthy. And if they're not, if we're sending sick animals and sort of shortcutting the protocols and not really being careful about those transports, then it's going to make it much more challenging for us to partner with one another moving forward. So we need to really make sure that if we're going to do transport, we do it properly and that we work with the right partners in making sure that the transports are in the best interest of the communities at both ends and most importantly, the animals in the middle. All right, so what should we keep? That's a really interesting question. We all learned a lot. We I think in our field need to always keep our eye on continuous improvement. If we're not looking at how can we do things better and more efficiently and more effectively every hour of every day in this work, then we're going to stall out. And so it's really important to always keep our eyes on that. What can we do to make things better for the community and for the animals at all times? That needs to be very, very much top of mind. And I think during this COVID crisis, we picked up a lot of things. We adopted some new procedures, policies. We came up with some really creative ideas for solving problems because necessity is the mother of invention. And we certainly had a lot of necessity over the last year and a half or so. So which of those things that we learned during the COVID pandemic do we want to consider hanging on to? Obviously, continuing to improve those things and continuing to morph into an even better, more effective industry throughout. So the first one that I will argue for is collaboration. We actually saw in the very early throes of the pandemic, March of 2020, we started working with a lot of other organizations at the local and the national level and brought together a coalition of people many of these people, because of the fact that they operate maybe under different operating philosophies and they've had different approaches to the work, have really had a hard time working together over the years. I think, we in animal welfare, since I started all those many years ago, we've been our own worst enemy in terms of sort of taking this to my way or the highway approach, and not really being willing to work together, realizing that if we look at what we have in common, it far exceeds those things that separate us. And thankfully, in this crisis, we sort of put all that baggage aside. A lot of folks who may not have had great relationships prior to COVID immediately started talking to one another. And it's remarkable what happens when people actually communicate, when they actually talk to one another and see each other as humans and as folks who have the best of intentions and are really working towards a common good. It's amazing how much more progress we can make when we actually realize that. And I'm as guilty as the next person, so I'm not throwing stones at anybody other than myself here. But I was thrilled to see the collaboration that we experienced in the very early stages, and that collaboration, I'm proud to say, continues right on into the present day. So the coalition that we built early on, we started having daily calls with folks representing all the organizations you see on your screen. We started having those daily calls in about the middle of March of 2020. And we kept the calls short. Nobody had time to sort of drone on. So we kept the calls relatively short. We had very specific agendas. And the idea was, what can we do to really cut through all of the garbage that's flying around? There was so much information and so much misinformation that was flying around about COVID. And of course, things were changing, on an almost hourly basis. We'd all be in the same gear, moving in the same direction, feeling really good about where we were headed, and then we'd hear a report about a tiger at a zoo in New York City that has tested positive for COVID, and then we're thinking, oh great, now we know that species of cats can get it. So now what happens? So it was things like that. There were these little curveballs that would get thrown at us, often several times in a day. So the information was changing. The recommendations from the CDC were changing. We were very fortunate. We had the AVMA participating in our group. And the AVMA was working very closely with the CDC, as were some of the shelter medicine programs at some of the vet schools around the country. So we kind of had an inside scoop at the CDC, and we were able to really keep our eyes on the latest and greatest recommendations, so that we could cut all that junk out and really just share back out with all of our members and all the stakeholders that we represent in the field. We could share this information with them in a really sort of abbreviated way, so that they didn't have to listen to all of that. So I'm really proud to say all the folks that you see represented on the screen and more. There were folks who came and went throughout this entire process, who came and got what they needed and contributed what they could, and then maybe moved on. But the bottom line is that we had a tremendous brain trust. There were a lot of really smart people on these daily calls who were helping to sort of shed light and filter some of the information and misinformation out. We were able to participate as a group. We were able to participate in some large international webinars with some of the lead experts on pandemics and infectious disease from all over the world, and it was fascinating. It was really heartening to be able to work alongside those scientists and to pick their brains and to get the best information we could get out to the folks in our field who may not have had access to those folks otherwise. So again, the organizations were very diverse in terms of their missions, in terms of the way that they operate, in terms of just philosophy, But any differences we had were put aside so that we could really concentrate on sort of that joint mission of filtering out the noise and getting as much information as we could to the folks who really needed it. We set up Facebook groups right away so that our members and others could share their best practices, what's working for us, what's working in our community, how are we keeping our employees safe. It's one of the big challenges we have, right? That folks tend to forget that animal shelters are operated by human beings, and those human beings were at great risk if they had to work close together. So what could we do to get as many of those animals moved out of the system as we possibly could? And how could we communicate best practices for keeping those people safe while they were working either in the shelter or out in the field? All of that very important. I'll share a little bit more in a minute about the Daily Digest, but that was a curated publication that we sent out every day for many, many months. Then we started reducing the frequency of it until it became almost unnecessary because things weren't changing at a rapid enough pace for people to need that. And we respected it. I didn't want to waste anybody's time reading a publication just for the sake of reading it. So we said, we'll do this as long as it's necessary. We'll put it aside when it's not necessary and keep it ready if we need to reactivate it and start sending it out again. We can totally do that. We had a lot of us on that coalition, the folks you saw on the screen and beyond, who were signing on to things, letters asking for, a state to open up their VCPR requirement for telehealth so that telemedicine was more widely available, given the fact that many veterinary hospitals were temporarily closed. And even if they weren't, they were doing very limited contact, curbside service and that sort of thing. Getting an appointment was taking people weeks or months because of the demand. And so we thought telehealth is really important. Its time has come and we need to do what we can to support that. So we were reaching out all the time, trying to advocate for changes to the law or temporary relaxation of guidelines and policies that had been long standing, because this again, that word unprecedented came in really handy when we were reaching out to local and state governments. And one of the things we advocated for the most strongly was that veterinarians and folks in animal welfare and animal care and control are indeed essential to the continuing functionality of the country. So it was really important that we went out there and really argued on behalf of that. And our voices were heard, and largely because there were so many of us who came together and our voices were loud and they were definitive in their requests. And in most jurisdictions, both veterinarians and animal services workers were considered essential service providers in their communities. So in addition to collaboration within our own space, veterinarians, animal welfare folks who already really work together on an as needed basis all the time, it's really important that we also look beyond just our own internal collaboration. Sure, we need all the animal welfare and animal services agencies in a given community to come together and focus instead of fighting. But is this an opportunity for us to think about more consolidation of those things? If you look around the country, consolidation prior to COVID was a pretty big trend. We were seeing a lot of organizations who were maybe providing duplicate services in the same market or in overlapping markets have come together and formed larger organizations, taken 2 or 3 organizations and made one larger, stronger organization. If you're living in a place where the geographic proximity is fairly close, it might make sense to really consider, do we need 3 executive directors? Do we need 3 fundraisers, development directors? Do we need 3 of anything? Or can we combine efforts, have 1 executive director overseeing all 3 organizations in a consolidated sort of format? And so I think COVID, because of the limited resources that we've all experienced, I think COVID it may be a real sort of enzyme, if you will, to help make that happen a little bit more broadly across the country. If you're already partnering with other organizations in your own immediate area, does it make sense to come together and to work together instead of trying to manage 2 or 3 or 4 separate organizations entirely? There's lots of information about that on our website. If you're interested in reading more about consolidation, it's certainly there. And then finally, in terms of partnerships and collaboration, really important, I think, that we start looking beyond our own field. I think we are a field that has been extremely shelter centric. We think that the world starts and ends inside the walls of our shelters, and that's simply not the case. Our shelters are very often addressing the symptoms of problems that are rooted in the community as a whole. And so, maybe we need to be thinking more about getting out into the community instead of just focusing on what's happening within the walls of our shelters all the time. So looking at things like, human services organizations, folks who are already providing services to underserved populations, the organizations who are battling food insecurity, how can we partner with them to make sure that they also stock pet food in their pet or in their food pantries. Organizations who are involved in helping folks with housing. That's going to become even more critical given the fact that this weekend we saw the end of the eviction moratorium at the federal level. Now, we know that evictions have been happening all over the country throughout the pandemic, despite the moratoriums. There are some landlords who just simply weren't impacted by the moratoria that had been imposed by the federal government. So we know that that's been going on, but there's a chance that there could be a true tidal wave now of evictions and people looking for homes. And a lot of those people have animals attached to them. And it's our job as animal welfare professionals to do everything we can to keep those families together and intact. We know that the best place for those pets is with their people, and certainly not in our shelters that are already starting to experience some overcrowding at this point. And plenty of other types of, I think you should always be looking at who can we work with outside of our own 4 walls? How can we reach these populations in our communities that we have probably in many ways neglected over the years? One of the things you'll find if you visit the association's website is we're very, very actively engaged in diversity, equity, and inclusion work, where we feel very, very strongly that our field has done a fantastic job of moving the needle in a positive direction for animals. But in many, many cases, we've kind of left the people behind. We have not focused on those populations that may need our services the most. And if you look at our own field, if you come to our conference where, we'll have 550 people in a room, God willing, after this pandemic, and you see very few people of color. It's almost all white people in that room. So we need to be inviting a diversity of human beings into our work. There are plenty of folks out there, and we just need to make sure that we expose them to the right opportunities and bring them in. Racism, systemic racism exists in our country, and it exists even in our own field. And we're gonna, if we do nothing else, we're gonna do something about that. So beyond the coalition and collaboration building, we really took a very active role in communication. I think we all are sort of siloed as organizations in the way we communicate with people out in the world about our work and about what we need for them to do, about how to mobilize them to actually get involved actively and participate in the work. But communication has not been particularly organized or well coordinated amongst people in our field. So you may see, every organization in the country suddenly sending out their own press releases about the same thing. And it gets really confusing to the public who are not living in our world every day and who don't have an intimate understanding of what our priorities are or the way we work. So one of the things that we really felt strongly about at the beginning of COVID was that we had to do what we could to control the communications that were flowing from leadership in this field out to the field, to the folks in the trenches actually doing the work. As I mentioned earlier, there were, I don't know about you, but every day my email box it's like a turnstile. There's emails flowing in all day long, that and phone calls. And if you're in a shelter environment, you get face-to-face in-person interruptions constantly throughout the day. So communication is tough. And filtering out all of that noise to really get to the heart of what it is you need to know in order to make the most sound decisions for your operations every single hour of every single day is really, really a challenge. So as I mentioned, we put together, as part of the coalition, we put together a communications task force. And the task force was made up of marketing and communications people from organizations across the US and Canada. It was headed up by Michael Robbins, who does that job. He's VP of Marketing Communications for the Atlanta Humane Society. And Mike really brought this group of, they were the dream team. They were the communications dream team. And they immediately went to work developing messaging that so we could speak with some sort of a unified voice to these 4 distinct audiences. So they had messaging that was geared specifically towards folks working inside the shelter, for folks working in the field, ACOs and others who are actually providing field services. For those foster families, there were folks, plenty of people who stood in line wanting to foster animals, but others who were really nervous about it because they didn't know what the risk was to their family by taking in animals from a shelter environment. And then finally, messaging for the general public. Folks were really confused. They were not hearing what we were hearing. They didn't have the kind of details. So there was all sorts of misinformation flying around about the transmissibility of the disease through animals. And so it was really important that we actually had messaging that we could share through the mainstream media and social media out to the general public so that folks could hear sort of curated information that was science-based as opposed to sort of gossip-based information. Our communication task force did an absolutely remarkable job. And I'm proud to say that many of those folks are still together. We're working on a couple of other issues that are not even really pandemic related. And we just discovered the power of having all of those great minds and creative thinkers coming together to work on common issues. And so we've kept the band together for some other work that we're doing right now. This is just a snapshot of the heading for the Daily Digest that as I said, went out literally every day for a number of months immediately following the first shutdowns from COVID. And the organizations listed were the ones who contributed to and curated the information that we shared out with the public. And then the association actually put it together and sent it out every day to a large group. I think by the time it was all said and done, it was going out to close to 9,000 people every day. And again, it was short and sweet. This didn't drone on and on. We cut out the things that were non-essential and just really focused on the things that people needed to know in order to move on about their day and plan for their next steps. So this one was good because we said a gift of time when we really were giving people back all the time they were wasting trying to read things that were not really critical. And the committee, along with several really brilliant folks on our team and other teams, developed some really helpful resources right out of the gate. We are working alongside the Humane Society of the United States and NACA, put together this shelter kit for COVID-19. And this kit really contained kind of all the basic information an organization needed to know to sort of mount their strategy to combat COVID and the spread within their shelters and their communities. NACA put out a number of policy statements, position statements right off out of the gate. They were excellently done and very, very well received by the industry. So those folks who may not have been in our circle of influence, but were part of NACA, were still getting some really important information. And we did everything we could to cross-pollinate between the two so that the information was being shared by both audiences all the time. And then many of you are probably involved already in HAS, the Human Animal Support Services Project. And this was also a coming together of people. It's all sponsored through American Pets Alive in Austin, Texas, with a lot of support from Maddie's Fund and others. But this is an effort to really look at how can we center some of the the services that have been very shelter focused to turning them into being more community focused. The project has got tons of working groups. If you're not already engaged, I know they would love to have you. I did put the web address there for the eviction toolkit, which again it was relevant the day it was developed, and we worked alongside HAS and the HSUS to get that done. It was relevant months ago when we first put it together, and it's even more relevant today, given the fact that the federal moratoria have been lifted. So these are all, all these organizations, along with the ASPCA and Best Friends and so many others, came together to really make sure that the information being shared, the resources we were putting together, were useful and were not redundant, and were kept updated, because, as I say, things were changing literally daily in those early days. Another thing that we definitely want to hang on to is the more widespread use of foster homes. Foster homes, I was amazed at the number, the surge in the number of people who are interested in taking these animals into their homes on at least a temporary basis. Shouldn't have been that shocking. A lot of people who had typically gotten up and gone to an office every day suddenly found themselves at home, and they had a little bit of spare time on their hands. So, and having something to do, something positive and constructive and helpful to do, and having the companionship of a foster pet, all sort of added to this big boom in foster care during the early stages of COVID. Now, I think the thing that makes me most proud about that is the fact that you all, those of you who are running shelters and working out in the field every day, this sort of proves what you mean to your community. You put a call out, shelters put a call out wherever they were and said, hey, we need to empty our facility. We don't want to have our staff having to come here and risk their own health and safety to care for these animals any more than they absolutely have to. The animals will be better off if they're out in a home environment. Our staff will be safer. It's just an all around better experience for everybody. And the beauty of it is that when you put that call out to your communities stepped up. They actually responded. And I think that says a lot about the way that communities respect the organizations that run shelters in their areas. So I talked to shelter leaders back then who said they had 1,000 people on a waiting list wanting to foster pets, and they didn't have enough pets, obviously, to even accommodate that demand. So that's really huge. Of course, the scary thing is that how long is this sustainable? Folks are starting to go back to work. They're starting to travel. People can go on vacations again. Airports are getting busy. Planes are full. Resort destinations have been incredibly busy over the last couple of months. So, and we've seen that the number of foster starts has diminished over the last several months. So is this something that is sustainable in the long haul? What can we do to continue recruiting and training the best foster homes out there so that we can keep the animals healthy and keep our shelters from being overcrowded? That's a big question. And I think it's something that, we saw the great benefit in this increase in the use of foster, but is it something that is sustainable in a sort of normal world. I think that remains to be seen, but I sure hope that it is. I hope that we have some success in keeping that going. I think, you know, it was also fantastic for adoptions. Let's face it. I mean, you know, we call them foster failures, but I think they're really more foster successes when those animals go out into a home and never come back into your care. I think that's generally a really good thing. So we talked a little bit earlier about this whole changing the focus and getting, you know, thinking about things beyond the walls of your shelters. So when I think about that, I'm thinking about issues like access to care. You know, right now we know that there is a shortage of veterinarians, and the projections are that that shortage is going to get worse over time. Our organization is working really hard to try and figure out ways to fill that gap, to make sure that animals, whether they're living out in the community or whether they're living in the shelter, have got access to all of the care that they need. It's a big, hairy problem, and it's gonna require a lot of creative thinking. Really proud to share with you all that right here in Tennessee, Lincoln Memorial University is actually getting ready to launch a pilot program for a mid-level practitioner. It'll be a master's level program. If you want more information about that, you can visit their website. I know they've got information there, but you know, it's just an opportunity to sort of expand the capacity of a veterinarian by having this mid-level professional who can perform a lot of the services and expand the reach of veterinarians in private practice or in a shelter practice. That's huge. You know, behavior and training services have been a big focus of ours for a number of years. And there are a lot of folks out there in your community who may not have had access to those. And so reaching out, going out into the community and finding out what the needs are, where the needs are, and doing everything that we can to address those is going to continue to be really important, particularly post-pandemic. You know, I think we've seen folks out of work, we've seen folks getting evicted, and the last thing we want is for them to also have to give up their pets as part of that crisis. So anything we can do to support those relationships and strengthen that bond between people and pets, I think is really absolutely critically important here. And then last but not least, I will share with you that I think the only reason PowerPoint was developed as a presentation tool was so we could show off pictures of our own pets. So this is my current crew. I've been out of sheltering for about 15 years, and I still have this many animals in my house. So it goes to show you, there's really, even if you step away from direct service sheltering, there's really no hope. We're always going to be a little overwhelmed with animals, but you know, they give me a reason to get up in the morning, and they put fuel in my tank every day. And that's what we mean to our communities. Every one of these critters came from a shelter or a rescue group, and they have enriched our lives in ways that I couldn't describe if I even tried. So, you know, keep on doing what you're doing, and keep on supporting those pet owners who adopt from you, as well as those out in your community. Make sure that everybody knows that you're there for them, that you've got services for everybody, not just for the chosen few. And I know your organizations will continue to be successful. I think that's all I have, unless there are any questions. I haven't looked at the chat.
Thanks, Jim. Does anybody have any questions for Jim?
Let's see, June McMahon. Hi, June. June said that she's been asking around about the paraprofessional for a couple of years and nobody could give her any info. Yeah, it's Lincoln Memorial here in Tennessee. I don't see anything else.
Awesome. Thank you so much for all the great information.
Hey, my pleasure. Thank you all for having me.
All right, folks.